The Women's Health Network is a space, a place, a forum for women and services to come together. It was set up to be that place where we can be creative, where we can understand, we can listen and learn together.
We started off in 2017 with a total of 49 members, and if we were to look at that makeup, the majority would probably have been at least halfway NHS and council staff, which is fine. The Women's Health Network is there for everyone. But as time moved on, our numbers grew to I think it's currently around about 250 active membership. And from within that pool, we've got individual women who have stayed throughout that journey. It was those individual people and women who made up that network and the passion they brought to it. I think as a collective, it was a lot bigger than the separate numbers. It really was that passion and enthusiasm that they brought.
Women's health is really, really key, and the Women's Health Network is a space for just that, where people can come and feel safe and talk about what's important to them, and have opportunities to meet other like-minded people.
Well, women's health matters because generally the women are the hub and the person in the family that kind of holds everything together. And if we're running on empty, we can't give to other people.
So we know that in Bradford district in Craven, where you live, it plays a big part in health outcomes. So for example, in the more wealthy parts of the district, you can live 10 years more life than someone who lived in a more deprived area, and those deprived areas are in sort of central Bradford. So 10 years less life expectancy. But then when you look at something called healthy life expectancy, which is how long people live in good health, the gap between where someone lives grows to 20 years less life. And I think that's something that's really important that we address and support women in those areas.
Providers of women's health or health services generally had some concerns specifically about women's health. So some of the concerns were about health providers not understanding why the uptake of cervical screening, for example, was low and was dropping year on year, and concerns around that women were not necessarily in good health when they were getting pregnant, and wondering perhaps if women understood the importance of that and what were some barriers and could there be some work done to encourage women to understand that more. So they asked some of us who were involved if we'd help them explore some of these issues.
The reason why it was important to have this was we knew from our information about services that women were maybe not accessing the services in the way that we would want them to. That from their stories, we were understanding the barriers and the poor experiences and some of the negative things that they were experiencing when they did access services. But also we knew that we were doing some good things and we needed to be able to share them, collect them and amplify them.
2021, West Yorkshire Combined Authority had put a call out across the region wanting to speak to women and girls around safe spaces. So basically the parks in Bradford and Keighley, did women and girls feel safe using them? Were there times that they would access the parks and other times that they were not comfortable? And to actually start to have those discussions and conversations. And the Women's Health Network organised, I think it was 3 or 4 separate focus groups across the district. Those interviews and focus groups, the information was gathered and collated, and that basically went even above Bradford. So it wasn't Bradford Council, it wasn't the NHS, it went into that regional pot. And that, we hope, help shape some of the national drivers and regional policies that have an impact on women and girls and the families living in Bradford and districts. So I think there are various examples that we could quote, but that's always the impact that we're wanting, that for people living in these communities, that we do see positivity and better outcomes for them.
One of the projects that I'm involved in now, it's Muslim families screening for life. And that came about by a breast care nurse being just really disappointed. She'd just had 2 young women who'd come into our symptomatic side where they had advanced breast cancer. So they would have been women who would have been living at home with a partner and other people, and nobody had noticed that they weren't well. So through the Women's Health Network, I knew to contact Ms. Shearer because I knew she was in Sharing Voices. I knew she was passionate, she was a woman. I also knew Hale was very into getting out into the community and speaking with people. And then my other connection was with Bradford University and Mel Cooper, Dr. Mel Cooper. I had also known that the Bosom Friends that runs in Bradford is well established. So we know that women generally love talking to other women. So Bosom Friends was a cancer support group, post-breast cancer specifically. Busy, but no non-white communities, or very few. Women report to us that we don't go because I needed somebody to read my letter or to take me, or deemed I didn't need it. And again, we'll hear that in GP surgeries where the men will say their wife doesn't need a health checkup. So all of these things fed into this project. If we could educate men about screening, cancer screening, would it make a difference in the female community? We have to see now if we can get the men to speak to 6 women to share information about cancer screening. They will benefit because they're getting more information as well, and because then they make the approach, hopefully then another man won't stop his partner taking up that.
I would absolutely recommend that every area has a women's network, has a women's space that brings together providers and communities to talk about how services can improve and how services can reflect the needs and the support needs of communities. I think in setting it up, what's really important is that connectivity and the humility to not be the power.